Hi, my name is Sean. I'm a registered nurse at Florida State College of Jacksonville. I'm currently in the ethics class, and my professor is Dr. Alma Dixon, and I'm doing my research project on the culture of India and talking about their healthcare system. But first, we're going to do an overview. We're going to talk about a lot of their demographics. We kind of have to build up before we talk about the healthcare section. We have to get to know with who we're talking about. Demographics. So, second largest population in the world. They are currently at 1.3 billion. China is also 1.3 billion, but the difference is about 83 million. China's still ahead. Male to females, there are 940 females per 1,000 males. So many more males than there are females. The literacy rate, 82% literacy rate for males, 65% for females, which equates to about a 74% overall. For comparison, the United States and Europe have achieved a 99% rate in both male and female. So, big difference there. Location, this country is divided into mostly 3 regions, which is also not that different from us, the United States. They have a mountainous region in the north. The Himalayas run through the border and kind of dip into the country a little bit. And then they have what they call the Indo-Ganges Plain, which is mostly, as it states, a plain. But this is where all the activity takes place. This is where all the fresh water, the rivers run through. This is where all the farming and agricultural areas are. Very similar to the United States, all of our flatlands in the Midwest is where most of our agriculture is. A lot of rivers that run through for us as well. And then they have, in their peninsula region, marshlands, wetlands. This is typically associated with south of Mumbai, which is a west coast city, if that for a point of reference. Also, if there are to be any earthquakes in India, typically they're going to be in the peninsular region. This is where the typhoons hit. This is where a lot of flooding takes place. This is in the southern region, which is not all too different from the United States as well, with a lot of our marshlands typically being in the southern states. Overall, there are 29 smaller states made of India. Fact less common, very similar to the United States, how we're made of 50. But they also have what they call union states. So this is a little tough to comprehend. But just as how our nation's capital, Washington, D.C., is run kind of separately from the state it's in, very similar for these union states. These are areas where the capital, the nation's capital, extends its reach and runs those areas. It's different because for us, our nation's capital, it's ran differently. It's all in one location. Whereas for them, the union states are kind of spread out, and those areas fall under jurisdiction of specifically the president. Typically, what's associated with their nation's capital. Religion is a very, very big part of India. It's mostly what they're known for, all the diverse cultures there. 80% are listed as Hindu. I say diverse, but it's mostly Hindu, but Hindus have a wide, varying array of different beliefs that come with it. And different people, are going to adhere to different principles, very similar to how Christianity for the United States has a wide array of different denominations and what different people adhere to. Talking about, going further down the percentage breakdown, the next closest, obviously it's going to be a very small percentage. If the main one is 80%, Muslims account for 13%. The second largest religion in the country, Christianity at 2%. Sikhs, there's sort of a breakdown from Islam, but they don't consider themselves Islam, but they do have Islamic principles. Not all Muslims wear turbans, but all Sikhs wear turbans. It's a common distinction of theirs. It's very important to their religion. And then less than 1% consider themselves Buddhists, and then the percentage breakdown after that to other for religion. So that's our patient demographic, if you will. And then talking about their healthcare system, let's talk about their diseases. This is what I found to be really fascinating. I'm going to talk about the top 10 causes of death in India. The first one being cardiovascular in nature. Second one, diarrhea, but diseases that are diarrhea in nature, which I'll expand about that in a little bit. The third, neonatal risks, health complications. The fourth would be what they consider non-communicable diseases, but I'll also expand upon that a little bit. Just need to get through my list first. Number 5, chronic respiratory issues. Number 6, diabetes. Number 7, mental health issues. Number 8, what they call unintentional, which is our auto accident equivalent, but they also put some different things in that category. Number 9, neoplasms, which is cancer. And then number 10, nutritional deficits, which is actually related to number 2, which are the diarrhea diseases. For comparison, in the United States, our number 1 cause of death is heart disease, also cardiovascular in nature. We share that in common. Number 2 for us is cancer. Number 3, respiratory complications. Number 4, auto accidents. Number 5, strokes. Number 6, Alzheimer's. Number 7, diabetes. Number 8, flu and pneumonia complications. Number 9, renal disease or kidney function disease. Number 10, suicide. The differences in these lists to reconcile is that for India, they specifically put things like stroke, kidney disease, flu and pneumonia complications in the non-communicable diseases, whereas we tend to pull that apart and dissect it a little bit. They also have suicide under their what they consider mental health, whereas we've broken that down, also related to Alzheimer's, but that's more neurological in nature. So there's a few differences of how things are kind of grouped between the lists, but overall the common theme is still there, which is that we're very similar. The next thing, the public health risks that they deal with, they have the third highest HIV population in their country, and they also have the third highest death rate. Now, the United States has the 10th highest HIV population, but we have less than 1% death rate for the HIV death rate. The biggest difference there, what that's telling you, is that we have the means necessary to provide care for these people, extend their lives, and that's not just, well, obviously that's related to not just, death from HIV, but, the health complications that come with it. We have not just the antiviral medications, but a multitude of other medications to help with any, complications or risks that come along with it. So much different in the infrastructure within their health system to care for things of that nature. Public health risks that they still deal with aren't really a concern for us, such as tuberculosis and different outbreaks that are very that are communicable, the opposite. And whereas that's not a big factor for us. Those are, every now and then they kind of erupt, but we have a really good handle in place, a really good system in place to handle those types of things and keep them under control. They're essentially, but that's what happens. We're a little bit ahead of them. And that brings us to our structure. We are structured very similarly. The CDC is working, CDCs worldwide. They're working very hard in India. They're set up very similarly to us. There's lots of small clinics, lots of small primary care offices, and just as much as there's big cities, there's big wide open spaces in India that they need primary care offices. Just in the same way that in the United States we have our very dense cities, but we also have communities very widespread, very rural areas that need access to health care that can't get to those big cities. And they had the same need. They have large hospitals, large facilities in the cities, and lots of small primary care offices kind of dotted throughout. And they struggle with the same thing as far as accessibility. They have free government hospitals, just as we do, and they also struggle with trying to obtain insurance. They have a private health sector, just as we do. So very similar with our trying to reach accessibility, trying to get access to health care. And then that sets us up for beliefs and spirituality. They are very family oriented. They have large families, more so than families in the United States, obviously, which is why they have a very high patient population or people population. Typically, because of the family-centeredness, whenever one person is sick, they all go, depending on where it is in the village. If some people have to stay to maintain the farm, if that makes sense. They can't all go, but depending on who it is and how sick they are, a lot of them are going, and that impacts their room sizes for patients and ER rooms, because they need to not just account for 1 or 2 people coming to the ER. Like if one person's sick, one person may have brought them, but there may be 6 people coming with that one sick person. And so to sort of break down their nursing implications, let's talk about this case study. This is a patient S, we'll call her, 23-year-old female. She describes herself as having struggled with symptoms of anxiety, shortness of breath, heart palpitations, and specifically related to this case, she was experiencing loss of sensation in her limbs for 6 to 8 months, or over the last 6 to 8 months. Feelings of impending doom. She would describe things such as like loss of consciousness. She would feel taken over, to use her own words, and during this she would exhibit violent behavior, incoherent speech, and mental health issues in India. They don't talked about. They don't talk about them at all. It's hush hush. It's swept under the rug. It's America 200 years ago, roughly, and as far as causes, what could they be? Her family ranges from people that were completely illiterate to family members with full-on college degrees. So a lot of them. So some would tell her that she had, she was being taken over by her ancestors. So some type of ancestral spirit possession, if you will. And so there's a big stigma with their mental health still that isn't talked about, or they try to, not really pay attention to it. The patient herself was very well educated. She had a college degree, and she did get hooked up with a primary care provider who was able to refer her to a psychiatrist. The family was open to it. They are open to learning, but that's what she struggled with was she herself wanted to go to a doctor versus a family member wanted to take her to a shaman, and they apply some type of rite or ritual or oil to heal her. So religion plays a very big part in their healing process, which is why we have to be sensitive. We have to be, careful when we discuss those issues. They still don't like male nurses. They still prefer female, even if the patient themselves are male. They still want female only. Females kind of have that caring spirit that they attribute it to. Nutrition. Much of this of the population is vegetarian, over 60%. Which just their 60% is double our population. It's 1.3 billion people in that country, so half that population, more than half, is going to be 700 million, which is double us. So we have to be sensitive when we talk about their diet and things that they need, and recognize that their diet is not our diet at all. And the things they eat, the cooking methods will still be the same. Not cooking with a lot of sodium, since they do have the same heart issues to talk about. Health promotion. They struggle with the same health promotions. We're still trying to. It sucks that we've kind of gone backwards a little bit with the anti-vaccination movement, or anti-vaxxers. But only 50% of their children in rural areas are going to be vaccinated with the vaccines they need. So there's a lot of health promotion related to vaccines. A lot of education still. Just as what we showed with that case study, trying to dissect, spirituality a little bit. Pull it back, talk about mental health disorders just as you would any physical ailment. The mind needs healing just as much as the physical body, which is the best way to describe it. So, very diverse culture, very open to learning, which is their biggest talking point. If they weren't open, then it'd be very hard to reach them. But they are, and these are my references, and this is my overall breakdown of India. As I said, my name is Sean with FSCJ. In the bachelor program. Thank you for listening to my presentation.